Hi, I'm Michael Tonner, and this is my final project for practice management. These are my two binders I had to put together. The first one is for a practice management binder, and it covers the pre-visit, the visit one, healthcare class, report of findings, and progressive exam. And then the second binder, which is my research binder, includes vertebral subluxation, wellness development care, subluxation condition-based care, chiropractic spinal, functional neurology and chiropractic, current mechanism systems, bad medicine, and new vitalistic systems. Alright, so I'm just going to go straight into what a first visit would be like at a chiropractic office. So hi, my name is Dr. Michael Tonner. What's your name?
Todd.
Todd, nice to meet you. So what is your major reason for consulting our office today?
So I've been having some shoulder pain, and then it's also been causing me to have headaches up into my head.
Okay, well, lucky for you, you're in the right place. We have a lot of those problems come through our door, and we've been pretty successful with treating those. So let me tell you what we need to do to determine how we want to take your care plan. So we'll start with three exams. First, a physical exam to just get a sense of where you're at physically, and next we'll do a chiropractic exam, which is more chiropractic specific. So we'll be taking some ranges of motion, doing some orthopedic testing, and making sure that everything's working properly and that we can move on with our care with you. And the last one will be an x-ray exam if needed. The x-rays are to be as specific as possible with our adjustments. So we'll get a lot of our palpable, or we'll be like touching and moving you with our chiropractic exam, and then with the x-ray exam we can get more specific of where your vertebral bodies or your subluxations, as you've probably heard, are, and then so we can correct them and get you on the right path. So let me take you through our office procedures. So when you come in, you'll report to the front desk, and usually she'll give you just a sheet to fill out, and we'll have a pretty orderly process in our office. We can go over more of this later, but mainly it's just when you get your schedule, we'll make sure that you're on time for your appointments. If at any time you need to cancel, make sure you kind of come in and tell us in advance, because we like to keep an orderly office schedule. I mean, it's okay if you miss one, but if you start missing more, then we're going to have to try to rearrange your wellness care or your care to best suit us and yourself. So next we fill out case history, and I'm gonna pay special attention to like your family history. So after this, I'd move on to the first visit after the initial visit. So what was the onset of your condition?
So I was just working out at the gym, and I was just performing like an overhead press, and I just kind of got this shoulder pain that's kind of like just deep, and it's been achy. So that happened probably like 3 months ago.
3 months ago. And does anything make it worse other than just, you told me working out, but is there any other like movements or like activities that you do throughout the day that could make it worse?
It's just kind of inhibiting like my daily life. Like I can't lift like at work or anything like that, or it kind of like pain when I carry a backpack, or pain when I try to lift stuff overhead or something like that. So it's kind of inhibiting my daily life.
Okay, and does anything make it better throughout your day?
Just kind of resting it and not using it, which is kind of hard to do.
Okay, and what's the quality of your pain? Is it a dull ache pain, or is it like kind of stabbing, or is it?
It's kind of a sharp pain when I move something, and then it's kind of dull and achy for a couple hours after I kind of, I guess, re-injure it.
Okay, and does it radiate anywhere else in your body, or is it mainly in your shoulder?
There it goes down into my arm a little bit, and then up into my neck, and it kind of causes like the headaches
Okay.
as
And
well.
as you said, your sight is just mainly your shoulder, but it would radiate up into your head and maybe cause some headaches at some point, and then into your arm. And do you feel some numbness or tingling in your arm sometimes?
No,
No?
not normally.
Okay, that's good. So upon your initial exam that we did before, we found a couple problems. Um, one of the problems you came in with your shoulder pain with some of the orthopedic tests we did, we were able to narrow it down to a few things, and also with our chiropractic exam and our x-rays we were able to find some specific subluxations that could be causing your pain. So since you're a new patient here, I like to explain to all my patients what kind of a subluxation is, and it's kind of a buzzword in chiropractic, and the best way to explain it is just to use the analogy of like a hose in your backyard. So if you think about a hose, what it's supposed to do, like water all your flowers, all your plants. But if you have a kink in it, then that water is not going to get to your plants, and they'll probably wither away and die, unfortunately. And that's not going to happen to you. What I'm trying to say is that when your body's not getting the right, like, not getting the right amount of stimulus is a good word, then you're not going to perform as optimally as you can, and you're going to start experiencing some pain in those areas where that aren't getting the right stimulus. So what I would like to do is form a care plan with you, get you on the right track and try to get rid of that shoulder pain for you, and then I feel like with the right chiropractic care and the right specific adjustments, we can get you on the right track to getting rid of those and having you functionally optimally in your life.